What does knee pain mean based on location? Why do I have knee pain? When is knee pain serious? Which doctor should I see for my knee pain? What are various treatments I can use for knee pain? Well, I went online and I put together the most common questions that people have about knee pain. Yours might be here as well, and I'm going to try to address a bunch of them. So let's dive in. What does knee pain mean based on location? Front knee pain usually means kneecap issue or that tendon under the kneecap is irritated. This is common in runners or people who do a lot of squatting. Pain on the inside of the outside of the knee. Now that might be a ligament sprain, a meniscus injury, especially if you have a sudden twist or a severe injury. Deep achy pain inside the knee joint usually points towards osteoarthritis. Pain in the back of the knee could be a Baker's cyst. It could be a hamstring injury, or in rare cases, a blood clot. So don't ignore it if your knee is swollen or the pain is severe. Location gives us a clue, but the doctors also look at your history, your examination, and maybe x-ray or even MRI to get a full picture of what's going on. Where is knee pain from arthritis? It usually feels like this deep, achy pain inside the knee joint. It's worse when walking, climbing stairs, or standing for too long, and better with rest. Stiffness after sitting or in the morning is also very common. You may also notice some mild swelling as well. Where is knee pain from sciatica? The pain from sciatica usually starts in the back, shoots down your thighs, and can wrap around your knees as well. Now, this is a nerve problem, not a true knee problem. It feels sharp, burning, or electric, and it can improve with movement throughout the day. Tingling or numbness that goes down your knee can also happen as well. Why do I have knee pain at night or while sleeping? Well, inflammation usually builds up throughout the day. And at night, you feel a little bit more because at that point, you're still, you're not moving. Why do I have knee pain after running? Well, this could be something called runner's knee. It can also be IT band syndrome or a meniscus tear, which can cause this catching or locking pain. Shoes, your running form, the distance you run, they also matter as well. If it keeps coming back, it's important to get this checked out. An x-ray or MRI might be needed for further evaluation. Why do I have knee pain when sitting, standing, or climbing stairs? This is usually from kneecap tracking problems or early arthritis. You see, the kneecap is supposed to track in this groove when you bend and straighten your knees. So with this kind of pain, the kneecap might not be sliding smoothly within that groove. This can cause irritation of the cartilage and pain as well. Going downstairs also puts a lot of pressure on the knee. Strengthening the thigh muscles and avoiding sitting for too long can be some of the things that you can do to, alleviate that pain. When is knee pain serious? Well, some of the red flags you should watch out for to determine whether or not knee pain is serious that requires prompt attention by seeing your doctor immediately is the pain sudden or severe after an injury? Does your knee lock and won't move? Is there major swelling? Is there redness with fever? Or you can't put weight on that knee? Now, this could be an infection. Does the knee give away, feel unstable, or looks even deformed? Has the pain in that knee lasted for a few weeks despite other home remedies that you've tried? These are some of the things that you should be looking out for. And if the answer to any of these is yes, then you should probably see a doctor sooner rather than later. When does knee pain need surgery or knee replacement? Now, surgery for knee pain is usually reserved for meniscus tears, ACL injuries, or arthritis that is not held by medication or therapy. Knee replacement is usually reserved for that advanced stage of arthritis, that bone-on-bone arthritis with daily pain and limited movement of the knee. There are 3 questions to ask yourself to determine whether or not to start having that discussion with your doctor about surgery. Number 1 is, are my bad days now more than my good days? Number 2 is the pain now affecting my daily life significantly, including work? Number 3 is it now affecting my sleep? If the answer to these questions are yes, 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 it's probably time to start having a discussion with your doctor about more options, including surgery. When is knee pain cancer? Knee pain is very rarely cancer, but if the pain is constant, it's worse at night, and it comes with weight loss or fever, you should probably see a doctor to rule out something that is more serious. Which doctor should I see for my knee pain? Who diagnoses and treats knee pain? Well, start with your primary care doctor. They can order x-rays and refer you to an orthopedic surgeon, for bone, joints, or surgical needs. They can refer you to a sports medicine doctor for injuries or overuse problems. They can also refer you to a physical therapist for strengthening and recovery. If autoimmune arthritis is suspected, they can refer you to a rheumatologist. The bottom line is you start with your primary care doctor and they can direct you towards the right path depending on what they're looking for or what they suspect. What are some home remedies for knee pain? Well, you can start with the RICE method, which is rest, ice, compression, elevation, stretching, gentle exercises, supportive shoes, and even some weight loss can reduce the strain on your knees. Are knee pain patches any good? Yes, sometimes for a short-term pain relief. They can numb up your knee area for a little while, but they don't fix the root cause of the pain. I find them most useful in situations where they've worked for you in the past, and you just need them for a short period of time where you might be anticipating being a little bit more active. Will knee pain go away with weight loss or exercise? Knee pain can be reduced with weight loss. Now, every pound lost takes away pressure of those knees. And the more you make those leg muscles stronger with exercises, they help support the knee joint and ease the pain and pressure as well. What imaging is used to diagnose knee pain? X-ray, CT, or MRI? Well, doctors usually start with an X-ray to look at the bones and checking for fractures, arthritis, or narrowing of the joints. If they need a closer look at the cartilage, the ligaments, and the meniscus, an MRI is the go-to test because it shows those soft tissues in very clear 3D imaging. CT scans are less commonly used for evaluation of knee pain, but they are used in situations like trauma where you have an acute fracture that is severely broken and has multiple small pieces. A CT scan is very good for looking at this three-dimensional imaging of the knee to determine how complex the fracture is, and it's also used to plan surgery. Can knee pain cause hip, back, calf, foot, and ankle pain? Yes. Knee pain can change the way you walk and redistribute weight across all these joints and potentially cause pain in the hip as well as the ankle and foot. And sometimes the reverse is also true. Hip or foot issues can cause knee pain. Fixing the root cause of the problem usually solves everything. That's why when you have knee pain and your knee x-rays are normal, it's important to remind your doctors to look above at the hip joint and below at the foot and ankle joints just to see if that's where the issue is coming from. So there you have it. A bunch of questions about knee pain addressed. The bottom line is that knee pain has many causes: overuse, arthritis, traumatic injuries, or even nerve issues. Key is to notice when and where it hurts and act early. Most knee pain will improve with rest, therapy, and simple changes in your lifestyle. Only a small percentage will potentially require surgery. So don't wait till that knee pain stops you from living your life. Now, if you have any additional questions that I did not address, feel free to drop them in the comment section. Let's talk. And don't forget to follow and subscribe, and I'll see you in the next video. Maybe I'll talk about ankle sprains or something.